doctors, Mr. Shivakumar, GM Marketing.
पूरा सामने देखिए सब.
Consultant spine surgeon at MGM Healthcare. As we said, like we are trying to extend our services to Agartala as far as the complex spine surgeries are concerned. So in spine surgery, apart from the routine spine work, what we have is like there are two ways of doing spine surgery. One is open spine surgery, other thing is keyhole or minimally invasive spine surgery. So in MGM we do most of the spine surgeries through keyhole surgeries, like you do open abdominal surgeries and laparoscopic surgery for gallbladder. Similarly, spine can also be done through small keyholes. So we are specialized in that. So that way MGM can offer those keyhole spine surgeries at Agartala. The second thing is like we are specialized in deformities like scoliosis or kyphosis. When there is a curvature of spine, abnormal curvature of spine in kids or in elderly or adults, we have a specialized team to take care of spine deformities like kyphosis and scoliosis. And the other thing we have is navigation facilities. So when it comes to spine, most of the patients they are concerned about safe spine surgery. So mostly they are worried about paralysis and other things. So to take care of that, we have two things. One is neuromonitoring. So while doing spine surgery, we actually monitor the spinal cord and nerves. We have that facility there. So for complex spine surgeries, we use neuromonitoring. And the second thing is navigation. Navigation is an advanced spine procedure wherein the entire spine procedure can be done through guided navigation mechanism. Like you have your Google Maps which guides you while you are driving your car. Similarly, during spine surgery, so each and every step can be monitored in a 3D view of the spine surgery, can be viewed in navigation system. So we have navigation there. So for complex spine surgeries, we use navigated spine procedures. So and the surgery at a fixed price, like we have price assurance program for some of the basic spine surgeries. So these are the things we are trying to extend our services to Agartala.
Specimen, we can do the biopsy, but where will you process it? So we need to set up all those things, and we do like transplants. Transplants are live related only. A close relative like father, mother, or a son or a daughter, or up to the second cousins level, we do after getting a permission from the government authority. We submit everything. If they permit, we do the transplant for a first cousin or a second cousin. And for I was talking about continuous ambulatory peritoneal dialysis, which is a better modality next to transplantation. If you look at this treatment modalities in chronic kidney disease, first comes the better treatment is transplantation, next comes the CAPD, next comes the HD. So the quality, if you look at the quality of life, PD is better than the HD. So we have about 80 to 100 patients for CAPD. They don't have to come to the hospital. They just have to be in the hospital for putting a catheter to the tummy and then get trained after 2 weeks. And hemodialysis, we have to create fistulas, that is AV fistula, which is an access to do the hemodialysis. That also we have to start doing here. And more than that, the awareness to the people about the kidney disease. And there is a huge lack of nephrologists in our country. I said 100,000 people are diagnosed with kidney disease every year. We have about less than 1,000 nephrologists in our country. And that too, especially, they are all concentrated in the, including us, in the urban setup, in the cities. The chronic kidney disease is one of the most, increasing in numbers, especially in India. It is about 100,000 patients are diagnosed or initiated on dialysis or transplantation in India every year. So the awareness is very little. And also there is a disequality between the rural and the urban population, because there is the health access, so many factors, educational or financial, wealth is a factor, because kidney disease is a very costly affair, whether it is dialysis or transplantation. So we would like to, in MGM, we are doing regular nephrology OPs for the general nephrology. That means diagnosing and treating a conservative treatment for the kidney disease, because kidney disease, if it is a chronic one, there is no definitive treatment. We have to maintain or to prevent the progression in the early phase. For that, we need to diagnose it early. Otherwise, it will progress to end stage. For end stage renal disease, the treatment is transplantation or dialysis. Dialysis, both hemodialysis is the hospital-based dialysis. We do continuous ambulatory peritoneal dialysis, is the home dialysis, which not it's not very popular in our country. So we do general nephrology, including the renal biopsies. We need to set up a pathology lab here in Agortala, because I saw one patient here, he needs a biopsy, but we don't have a pathology lab or to process the biopsies.
For coming and grace this occasion. So from our end, we are MGM Healthcare from Chennai. MGM Healthcare Chennai is a quaternary care healthcare center situated heart of the city in Chennai, which is catering around core services as well the quaternary care healthcare services in India. This is one of the fastest growing healthcare organization in India, which serves right from core therapies like pediatric, mother and child, and right from nephro, uro, as well as spine surgery, neurology, and all the core therapies under one roof. And not only that, we are also offering quaternary care healthcare services like transplant services, ECMO, and all the critical care services. So when it comes to transplant services, MGM Healthcare is the only organization which did all the solid organ transplants in first 2 years of its history. Right from heart and lung, liver, renal, and all the complete solid organ transplants that MGM Healthcare is offering. So we are coming to Agortala to cater the quaternary care healthcare services and the core services in Agortala, so that we serve the patients who are ailing in Agortala, and thereby we are bringing those patients who wanted to take care of the next level services in Chennai through MGM Healthcare Hospital. And about MGM Healthcare Hospital, MGM Healthcare is only one center within 2 years have got so many accreditations like NABH, JCA, and LEED certification awards. So MGM Healthcare is one of the healthcare destiny in Chennai, which you can opt for the people of Agortala. So thank you so much for coming and grace this occasion. And this is Dr. Sri Chandran, our cardiologist, and Dr. Millie Matthew, our nephrologist, and Dr. Vijay Raghavan, who is our spine surgeon. So you can post your questions, or you can post your doubts, whatever you want to hear it of. So we are partnering in hands with MediPoint Health Services in Agortala. So with Mr. Shyam and their team, we are joining hands together, and we are monthly once we are planning to come for the core therapies, and once in 2 months we are going to come for the next level quaternary care transplant services in Agortala. So that is the plan moving forward. Thank you very much. MGM Connect Centers. Across India we are doing MGM Connect Centers. So one is that we are launching in Agortala through MediPoint Health Services. And second one, the most important point is, as Dr. Vijay Raghavan rightly pointed out, the surgery with price assured packages. So for top 24 to 25 surgeries which are commonly conducted, Arbin comes under a proper price tag. So the well-defined price procedures, it will be there. So it will be done within this price. So this is one of the unique selling point, USP of our MGM Healthcare.
As our previous speakers have told, we are Advanced Cardiology Center in Chennai, where we do extensive work as far as the coronaries are concerned. Our scope of services include non-invasive and invasive. Non-invasive, as you all know, echocardiograms, ECG statements, dobutamine stress echoes, and other various tests. As far as invasive coronary work is concerned, we are one of the quaternary centers in Chennai, where we do 24 hours primary angioplasties. We do specific interventions as far as calcium is concerned. We do multiple imaging technologies like IVUS and OCT. We have multiple devices such as rotablators, we have intravascular lithotripsy. Not only that, we are one of the few centers in Chennai to have laser device. Nowhere in Chennai, apart from MGM and maybe 1 or 2 centers, do we have laser device. Now, laser is a new technology where we debulk a calcium in a coronary vessel before putting in a stent, so that the results, outcomes are much better. Not only coronary work, we also do a lot of work as far as heart transplantation is concerned. Not only heart transplantation, we also do specific work as far as LVADs, that is left ventricular assist device, and right ventricular assist device are concerned. Not only that, even pediatric cardiac cases, lot of pediatric camps are being conducted there. Lot of pediatric complex cases. In fact, recently, 10 to 15 days back, we did a case for a baby which was like 170 grams. So multiple complex coronary work are being done in India. I think we will have a great time having a dialogue with Agartala. Thank you.